The global COVID-19 death toll stands at more than 1.3 million. Among the lives lost have been those of the healthcare workers who have had crucial roles throughout the response and continue to serve at the front lines. It is not possible to honor all the health workers who have died from COVID-19, but in telling the stories of few of the health professionals from different specialties and various countries who lost their lives to the disease. These short obituaries serve as a tribute to the many other health workers who have died in the pandemic. Yasin Abdel Warith. Yasin Abdel Warith was an epidemiologist and public health specialist. He was born on September 26, 1947 in a village in Yemen's Taiz Governorate. Yasin Abdel Warith was involved in the response to major disease outbreaks across Yemen for nearly 50 years. He was not surprised then that WHO brought him in as a consultant to help when COVID-19 emerged in Yemen. Despite the outgoing conflict in the country, Abdel Warith immediately go to the work organization surveillance team and getting up isolation centers. Yasin Abdel Warith died on June 16, 2020 in Sana'a, Yemen at the age of 72. Arpik Azratian. Arpik Azratian was an epidemiologist who specialized in viral hepatitis. She was born on June 25, 1950 in Romania. Arpik Azratian joined the Department of Epidemiology and Modern Vaccination Technologies at what is now IMC of First Moscow State Medical University at a crucial moment in 1997. An expert in viral hepatitis, her arrival coincided with a period at the turn of the century when the problem of parental viral hepatitis was especially urgent both in Russia and in the world, said her colleague Elena Simonova. Arpik Azratian died on March 27, 2020 in Moscow, Russia at the age of 69. Sarah Bravo Lopez. Sarah Bravo Lopez was a primary care physician. She was born on June 20, 1991 in Ciudad Real, Spain. There is a tradition at the Faculty of Medicine at the University of Valladolid in Spain that when medical students reach the end of their studies, they celebrate a last dinner with their professors. Although she had a leg injury as her classmates' event approached in 2015, Sarah Bravo Lopez was determined to take part in the celebration. She kept dancing all night happy because we are finally doctors, said her classmate Ruiz Cabezud Molera. She died on March 29, 2020 in Alcázar de San Juan, Spain at the age of 28. Claudia Nogueira Cardozo. Claudia Nogueira Cardozo was an endocrinologist. She was born on October 12, 1963 in Rio de Janeiro, Brazil. Claudia Nogueira Cardozo always made sure to keep extra medical supplies in her car or her bag. As she traveled around Rio de Janeiro, Brazil, where she lived, she offered help to people in the community. She was very charitable, a friend and companion who always had a friendly word. Her brother Claudia Cardozo said she must be remembered as a person who liked to help everyone. Claudia Nogueira Cardozo died on April 8, 2020 in Rio de Janeiro at the age of 56. Libby Carrion. Libby Carrion was a former director of epidemiology of the Institute of Public Health, Bolivia State, Venezuela. She was born on September 9, 1953. In Puerto Hierro, Venezuela. Libby Carrion studied medicine at the Universidad de Oriente in Ciudad Bolívar, Venezuela, a school with the motto "From the town we come from and to the town we go." She would go on to dedicate her career to providing medical service to neglected communities, often in far-flung locations. Her sublime love and dedication to helping the needy encouraged her to study and to work for 35 years in public health, never practicing private medicine, said her daughter Catherine Silvaran. Libby Carrion died on July 25, 2020 in Ciudad Bolívar, Venezuela at the age of 66. Nino Antonio Casanello Layana. Nino Antonio Casanello was an internal medicine specialist. He was born on January 12, 1945 in Guayaquil, Ecuador. Nino Casanello taught his medical student what he called the principle of responsibility. He believed that students needed to get to know their patients on a personal level, and he encouraged them to ask about not just the medical problems, but of what kind of job he does where he lived, about his family, said Cristobal Sanchez-Mates, an adult hospitalist specializing in internal medicine in Washington, USA, who studied under Casanello for 3 years. Nino Casanello died on March 26, 2020 at the age of 75. Adil Altair. Adil Altair was a surgeon and organ transplant specialist. He was born on March 10, 1956 in Atabara, Sudan, and died on March 25, 2020 in London, UK, aged 64 years. As a young doctor working in Sudan, Adil Altair became aware of the rising problem of kidney disease, particularly among young people. Without access to transplant surgery, patients are dependent on regular dialysis, which disrupted their ability to work or study. His mission was to replace the country's largely privatized, fragmented transplant service with a centralized registry and practice. He wanted to build this service that could breed excellence, whether in diagnostics or on the operative or medical sides, said his cousin Hisham Al-Khidir, a surgeon working at the Norfolk and Norwich University Hospital in UK. Salvacion Seri Rodriguez Gazalian. Rodriguez Gazalian was a president of the Philippine Pediatric Society and former assistant director of the Research Institute for Tropical Medicine at the Philippine Department of Health. She was born on December 4, 1952 in Manila, Philippines. Salvana drew close to Gazalian during the controversy over the use of dengue vaccine, Dengvaxia, that erupted in 2017 in the Philippines. Gazalian, a long-time immunization advocate and the co-founder of the Philippine Foundation of Vaccination, was among the experts trying to rally support for vaccination while warning that misinformation about vaccines could lead parents to avoid immunization their children altogether. Gazalian died on March 26, 2020 in Manila at the age of 67. Mustafa Kamal. Mustafa Kamal was a surgeon and Vice Chancellor of Lister Medical University in Pakistan. He was born on September 15, 1959 in Multan, Pakistan. Mustafa Kamal was in the midst of transforming Lister Medical University when he died of COVID-19. Named the first Vice Chancellor when the university was elevated from a college in 2017, he was working to introduce new programs in the institution and overseeing the construction of a new 500-bed hospital. Mustafa Kamal died on July 15, 2020 at the age of 60. Richard Kiser. Richard Kiser was a consultant surgeon. He was born on October 26, 1962 in Tema, Ghana and died on July 2, 2020 in Accra, Ghana, aged 57 years. As a consultant surgeon at the Trust Hospital in Accra, Ghana, Richard Kiser colleagues knew they could call him any time for assistance or a consultation, even after he had left work for the day. He was always willing to turn around and come back, said Nilante Okunka Blankson, a specialist physician at the hospital. He never shied away from hard work. He volunteered to do so many procedures. Jitendranath Pandey. Jitendranath Pandey was a pulmonologist and former head of the Department of Medicine at All India Institute of Medical Science. Born on June 14, 1941 in Shikohabad, India, he died on May 23, 2020 in New Delhi, India, aged 78 years. Although he was a legendary pulmonologist called upon to treat presidents and Bollywood stars, Jitendranath Pandey made time for everyone. His office door was open to colleagues, students, and especially for patients. He gave a lot of time to patients, said Abhishek Bhatia, the director of Sitaram Bharti Institute of Science and Research in New Delhi, India, where Pandey worked later in his career. He was meticulous and he would never rush patients. Instead, Pandey used to frequently remind his students that patients are the best teachers. Raphael Pempinello. Raphael Pempinello was an expert in infectious disease. He was born on May 7, 1944 in Naples, Italy and died there on April 29, 2020, aged 75 years. As the COVID-19 pandemic battered Italy's health system in March and April, doctors around the country came out of the retirement to assist. Raphael Pempinello was no exception. When a friend of his fell ill with COVID-19, Pempinello, an infectious disease specialist who had retired in 2013, offered to help, telling his wife that a doctor could never refuse to treat a patient.